the CARE Country Director for the West Bank and Gaza, Hiba, Tibi. Thanks so much for joining.
Thank you. Thank you for having me.
So we know you're monitoring aid flows very closely. The UN said that there has been a higher flow of aid going in April than there was in March. 35 CARE trucks have entered as well. I'm finding are you finding at least that more aid is getting in, and is it close to sufficient for what is needed there?
So more aid is getting in, but it's not in any way close to be sufficient. Unfortunately, no one expected that this war will last for 7 months. So you can imagine that it is accumulating needs over needs. And if even, for instance, in April or in May, hopefully in May, there will be more aid entering, the number should be as high as possible to correspond to the needs that are at various levels, and to also to meet the needs of people in the south, and most importantly in the north. And of course, what would make it much better with sustained impact would be to have an enabling environment for us to reach specifically those who are most vulnerable.
A new report from Médecins Sans Frontières, Doctors Without Borders, use that phrase I just said. Necessary conditions for survival are absent. This relating specifically to the healthcare system there. Can you explain what that means to people at home right now?
So, as you know, that health system is connected to different components. This includes, for instance, hygiene practices, good nutrition, weather-related diseases. All of the conditions that are currently in Gaza are considered, according to some of the specialists, the perfect combination for death if, unfortunately, more sustained aid and restoration of the basic requirement services, including hospitals, fuel for running desalination units for water, would be very important. Without that, the situation will become even more and more worse, and especially if we are thinking of potential Rafah offensive that everyone is talking about.
Who do you blame for the lack of aid?
So unfortunately, what we wish for is that the international humanitarian law is respected by all of the actors everywhere. And this will be, if the humanitarian law is not respected, then unfortunately those who are not respecting it would be the ones to bear the biggest responsibility when it comes to saving the lives that we are losing on a daily basis.
I know that U.S. officials have been pushing Israel to allow more aid in, but do you believe that Hamas bears some responsibility as well? There have been frequent reports of Hamas stealing some of the aid or redirecting fuel for their own uses.
So unfortunately, we hear this news, but no one can guarantee or can give confirmation on if this is happening on the ground. In all cases, what is entering is very limited. And if there are any diversion of aid entering to Gaza, it would make it even worse and worse. And this is what we hope that it is not happening. Confirmation on the information, I cannot give it. But for instance, I can share with you what happens with CARE. All our aid trucks are entering. We don't store them. We immediately distribute them. So we did not face anything, any incidents that I can report back.
That's an interesting strategy. As you know, after the IDF killed 7 members of a World Central Kitchen team, World Central Kitchen has now resumed their operations. But the IDF promised after that killing that it would increase safety for aid workers, introduce new protections. Have there been any changes since that strike that you've seen?
So unfortunately, we have heard of another aid worker in another organization, international humanitarian organization, that was lost after the World Central Kitchen. We try our best as organizations to coordinate, to deconflict, to share the coordinates of what we are doing, where we are heading. There are lots of commitments that are coming from the government, the Israeli government, and we hope that this will be translated on the ground. So far, it is commitment. These are commitments, but we wish that they are translated.
You mentioned earlier the Rafah operation, and Israel says that if it does proceed with this, and by the way, it says it will proceed, it will take measures to protect civilians there. Do you believe that? And do you believe that it can take measures to protect civilians if it decides to go into a densely populated area?
So I think based on what we have seen with the beginning of the war, and then later on within the evacuations that occurred in Khan Yunis, no matter the measures that are, if it worked, and unfortunately it did not work previously, the number of people, the density of population inside the south is massive. Any intervention, if military actions would affect in other locations surrounding communities, then you can imagine what will happen with people seeking shelter in the streets. An estimation by the UN agency said today, or 2 days ago was released actually, that evacuation of people in Rafah would require 10 days for 1.5 million. And we don't expect that we will be given as a community actor 10 days to evacuate before it happens, unfortunately.
Well, we appreciate the work you're doing in Gaza. Hiba, Tibi, thanks so much for joining us.
Thank you.